You've now reached the section of this e-learning module that focuses on how to deliver the return intervention in practice. In this video, I'll give you a brief overview of how the online toolkit works and how it supports you when you're delivering the intervention to your patients. The return intervention is a behaviour change conversation with supporting booklets and videos aimed at the 6 common barriers patients experience to visiting the dentist. The barriers explored within the intervention are cost, time, not thinking to go when not in pain, not having trust in dentists, embarrassment, and anxiety. There are booklets and videos dedicated to each of these 6 barriers within the online toolkit. Your job is to help the patient decide which barrier or barriers are most relevant to them, and then use the booklets and videos to support a meaningful conversation around visiting the dentist. All of the return intervention resources are accessed through the return website. To find them, go to the website and access a section for the dental team and click on the Delivery tab. This is where you'll find everything you need to deliver the intervention with patients. The toolkit can be accessed on a computer or tablet and is designed to be used together with the patient during an urgent care appointment. The online toolkit is there to support you. It helps guide the conversation, keeps the intervention structured, and links you to the right resources at the right time. It is not a script and it does not replace your role in listening and responding to the patient. Think of the toolkit as a framework that supports a patient-led conversation where patients are able to select a barrier to dental visiting that is relevant to them. The return intervention is designed to be delivered during an urgent care appointment. It works best if the patient is in a setting where they feel comfortable sharing information. For example, it is not recommended that you have the conversation while the patient is in the dental chair, particularly if they are nervous. You might decide a quiet room, empty surgery, or even a quiet waiting room is more appropriate. The full intervention takes around 15 minutes to deliver. The return intervention is broken down into 5 simple steps, and the toolkit will take you through these steps one by one. At each step, it prompts you on what to focus on and automatically opens the relevant resources. The content adapts to the barrier the patient selects, so you don't need to memorise the steps or decide which resources to use. The toolkit does this for you. Throughout the intervention, your role is to listen, ask open questions, and remain curious and non-judgmental. The toolkit supports the conversation, but you are central to how the intervention works. Each conversation will be slightly different depending on the patient and the barrier they choose to focus on. In the pages that follow, you'll be taken through each of the 5 steps of the return intervention in detail. You'll see how to use the toolkit at each stage, what to focus on in your conversations with patients, and how the different resources link together. Remember, this is not about delivering a perfect conversation. The aim is to create a supportive space, use the resources flexibly, and help patients take a first, realistic step towards ongoing dental care. Now move on to the step-by-step guide to delivering the return intervention.